Hi everybody, this is part 2 of my chat about the impact of fluoroquinolone antibiotics on possibly stimulating or triggering or exacerbating chronic health issues. If you didn't watch part 1, please watch part 1 for the background on this. So the way in which these fluoroquinolone antibiotics can have a negative impact on human physiology, to my understanding, is primarily through damaging mitochondria. Those mitochondria, they just keep coming up in conversation when we're talking about so many different topics, especially around complex chronic illness, and that's because they're incredibly important when it comes to talking about complex chronic illness. The reason, to my understanding, that they are so toxic to the mitochondria is because they have a very unique chemical composition to them. And without getting into the nitty-gritty, nerdy details, essentially the fluoroquinolone antibiotic can get inside of the cells of the body, and then has a hard time getting back out again. The acidity level inside of the cell is not conducive to the fluoroquinolone antibiotic basically dissolving or being soluble in that pH. And so as such, it's sort of like the drug just sediments inside the cell and stays stuck in there. And if the drug was benign, not a problem, but unfortunately it's not. The drug actually works to chelate or bind certain key minerals inside of the cell, including magnesium, iron, zinc, and manganese, all of which are really important for lots of cellular functions, but all of them are very important for mitochondrial cellular function. There's also some evidence to suggest that the fluoroquinolone antibiotic residue will interfere with the creation of something called the mitochondrial transition pore, and when that's off kilter, then it can cause the mitochondria basically to die more easily, and that's not good. So basically, the fluoroquinolone antibiotics can be very toxic to the mitochondria, and they just get stuck in the cell and just don't go anywhere. That cell dies, and then that fluoroquinolone antibiotic can get into the next adjacent cell and just kind of persist for a very long time. Now, in my experience, patients with fluoroquinolone toxicity oftentimes will improve over time without treatment, but it tends to be very, very slow, and it doesn't always happen, unfortunately. So if you're listening to this, or someone, if you're listening to this and you're suffering from fluoroquinolone induced toxicity yourself, or somebody who is, and you're like, oh, like I've been just as sick for years, or getting worse over time, there can be other variables that can contribute to that being the case. Over time, with cell turnover, the fluoroquinolone residues should start to become less over time, but if there are other variables like mold toxicity or chronic infections or other things that are interfering with mitochondrial function or things that are interfering with detoxification pathway function, then that can ultimately really impair the body's ability to get rid of these fluoroquinolone residues, and then the symptoms can just kind of persist or get worse and worse over time. So at the end of the day, in my experience, the best approach to work with to help address fluoroquinolone toxicity is to certainly address other underlying root cause factors that might be making the fluoroquinolone toxicity worse, but we also want to make sure we're supporting those mitochondria, which is very important for many patients with complex chronic illness, but we also want to work with things to try to help flush those fluoroquinolone residues out of the cells as well. And that process can take a while. Unfortunately, it's typically not a fast process, but working with the right types of detoxification supports, working with certain mineral supplements and things like that can help to expedite things. Also, the other quick little thing I'll mention here before I wrap this video up is that where fluoroquinolones will oftentimes target tendons and can sometimes lead to like full-blown rupture of tendons. There is a therapy called platelet-rich plasma therapy, which when combined with ozone therapy can be very, very helpful at to address the tendon issues that arise from fluoroquinolone toxicity and can really help to heal patients up. So I've had patients where internally they're doing so much better. Their mitochondria seem to be on track, energy's doing better, brain fog's gone, like they're doing really, 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 really well. However, they have residual pain in their various tendons in their body, and so it's kind of like, okay, we've cleared things out, but there's some residual damage. Well, the growth factors from the PRP synergized with the ozone can be really, really helpful to help heal that up. So definitely treatment options that are available when there are these fluoroquinolone-induced syndromes or fluoroquinolone-exacerbated syndromes, but you have to know the right approach to take to help get things on track. So it's kind of a complex issue, but there are treatment options that are available, and I've seen some profound improvements in patients in my practice. I hope this information was useful. If you have any follow-up questions on this topic or anything else, please post in the comment section below, and I will leave it there for now.